hospitals generate extremely large amounts of waste each year, and Western Health is no exception. It is necessary to segregate some of this waste as clinical waste to protect human health and the health of the environment. For every ton of clinical waste generated, the equivalent of 42 family-sized cars are added on the road each year. In practice at Western Health, only 50% of what is being discarded as clinical waste is actually clinical waste, and that is a bad thing, a very, very bad thing. Clinical waste must go through some form of decontamination before it can go to landfill. Incineration, autoclave and shredding, or treatment with hypochlorite, which is the norm in the state of Victoria. Did you know it is illegal to put clinical waste directly into landfill? Western Health can be fined tens of thousands of dollars for breaches of this legislation. The financial cost for Western Health is considerable. Clinical waste costs 10 times that of landfill to dispose of. $1,000 per ton of clinical waste compared to $100 per ton for landfill. Therefore, ensuring waste goes into the correct bin saves a great deal of money that could be used for patient care. So, what exactly is clinical waste? It is waste originating from healthcare with the potential to cause disease, injury, or public offense. Blood and body fluids, materials or disposable equipment contaminated with blood or body fluids, all are clinical waste. Body fluids are those encapsulated in the body, such as cerebrospinal, biliary, or lymph fluid. These are considered clinical waste because they contain blood, even if you can't see it. Wound exudate is not encapsulated in the body. However, it does contain blood and lymph fluid, so it is also clinical waste. Vomitus, urine, and feces, also not encapsulated, are only considered clinical waste if they are bloodstained or infectious. Sanitary items generated by patients on a ward are clinical waste. Samples taken for routine bedside or ward testing are not clinical waste unless blood is present, but all other laboratory and tissues samples are clinical waste. Waste from patients known to have or suspected of having a communicable disease. For example, waste from patients with resistant organisms such as VRE or CRE, or from someone who has gastroenteritis is clinical waste. Sharps are a special form of clinical waste disposed of in sharps-only containers. Sharps waste includes syringes with needles, lancets, scalpel blades, or anything capable of cutting or penetrating the skin. You can refer to posters around the hospital or your two-sided ID card for a handy reminder. So, now that you have a firm grasp of the definitions, let's put it into immediate practice. First, with the disposal of waste during an IV cannulation. Ensure your trolley is set up with a clinical waste bag, a landfill waste bag, and a sharps bin. Conduct the procedure as normal, ensuring that the needle is disposed of into the sharps bin, blood-stained waste is disposed of to the clinical waste bag, and the rest are disposed of to the landfill bag. That wasn't so bad, was it? Similarly with dressings. Again, your trolley is set up with the correct waste bags, clinical, landfill, and sharps bin if required for disposal of staples, scalpels, etc. Blood-stained waste is disposed of to the clinical waste bag. The rest of the materials is disposed of into the landfill bag. And look here, if the dressing is larger than the small clinical waste bag on the side of your trolley, you can use the bluey to facilitate correct waste segregation. Wrap it up and dispose of it into a larger clinical waste bin. Easy, but make sure you don't wrap up any landfill waste with it. So, sharps into the sharps bin, blood-stained materials into the clinical waste bag, and packaging, instruments, trays, and unused materials into the landfill, ensuring there is not blood or other contamination. Finally, VRE patients need special attention. In addition to the procedures outlined previously, contaminated waste from VRE patients should be disposed of in the clinical waste pedal bins provided for isolation rooms. So, there we have it. With correct waste disposal, we can enhance our sustainable future, minimizing our environmental impact and save money. All staff at Western Health have a responsibility to avoid the generation of waste and to maximize reuse and recycling wherever practicable. Together, with a little more attention and careful application of procedures, we can do it.